In 1985, while polio was paralyzing 1,000 children a day, Rotary International committed to a goal of ending polio worldwide. Very soon now, after contributing nearly $600 million and immunizing over 2 billion children, the goal will be achieved. Eradicating polio worldwide. That is humanity in motion. That is Rotary.
At Rotary, both internationally as well as here in District 6970, our priority is a complete worldwide eradication of polio. This program will give you an update on the status of the Global Polio Eradication Initiative, the role of Rotary International in this effort, and what you and fellow Rotarians can do to support the $100 million Polio Plus Challenge. Our commitment to the children of the world is to provide them with a life without the fear of being stricken with polio. Our challenge is to raise enough funds to make this dream real. The Bill and Melinda Gates Foundation has awarded the Rotary Foundation a $100 million grant, which Rotary will match over the next 3 years. It is the largest grant ever given to a volunteer service organization.
On behalf of all of us at the Gates Foundation, I'd like to extend our heartfelt thanks to Rotary members worldwide for your extraordinary efforts to defeat polio. Not every organization would be able to rise to a challenge like this one, but then again, no other organization is like Rotary. That's why the Gates Foundation recently announced a $100 million challenge grant to support Rotary's campaign to defeat polio. This grant is our vote of confidence in Rotarians around the world and in your partners in the Global Polio Eradication Initiative. We believe very strongly that you will achieve what you set out to do. We hope that this challenge grant will be a catalyst for the final stages of your campaign and help bring in even more funds to support the cause. I know that all Rotarians feel responsible for keeping the promise that your organization made more than 2 decades ago. I feel certain that you will keep that promise, and in doing so, you will benefit the world for many generations to come.
So where are we in reaching our goal? When Rotary first launched its Polio Plus program in 1985, there were 350,000 cases of polio each year in over 125 countries. Today, there are only about 1,000 cases per year, a 99% reduction in the number of infections. So we are very close to our goal. Now only 4 countries remain polio endemic: Nigeria, Afghanistan, Pakistan, and India. Since 1985, more than 2 billion children have received the oral polio vaccine. We have prevented 5 million instances of polio and 250,000 deaths. But the last 1% will be the most difficult. New tactics in endemic areas such as Nigeria include immunization plus days. IPDs offer communities additional immunizations and health interventions along with the polio vaccine.
They send volunteer, young, adult, I guess whoever want to be a volunteer, with a Rotary t-shirt. With the transportation is whatever they can have themselves. I don't think that this is Africa. We have bad roads sometimes, so it's going to be by car, it's going to be by bicycle, it's going to be with motorbike, whatever, even by feet. Whatever kind of transportation those volunteers can have, they're going to use it and go door to door. Really, for me, the most important thing is to see that the door to door is really necessary. You have people living very far from major hospital, far from little clinic, even if it's a community clinic. So it's really sometimes difficult for those people to reach those places, and the Rotary is going to them.
Since the IPDs, the proportion of children in northern states of Nigeria who had never been vaccinated was reduced from more than 50% at the end of 2005 to only 20% in 2006. And the First Lady of Nigeria recently immunized Nigerian children against polio during an Immunization Plus Day, demonstrating the high-level government support of polio eradication in the African nation.
The prevention is so easy that it doesn't make sense to even see some people, the few population, the few amount of people who still have polio in the world. It's sad, but it makes me feel proud to know that this is something that maybe the next 5-10 years we're not going to have that kind of disease anymore.
In order to contact the hard-to-reach populations of Afghanistan and Pakistan, immunization posts have been set up at key migrant gathering areas and known border crossings between Afghanistan and Pakistan. Campaigns are being coordinated to vaccinate children traveling within these groups. Dr. Margaret Chan, director of the World Health Organization, has met with the President of Afghanistan and the Prime Minister of Pakistan and has received their full cooperation. In fact, Afghanistan's president launched a national polio action group and has taken direct oversight of all polio activities in his country. The current campaign in India calls for sharply increasing the number of large-scale polio immunization activities focusing on children less than 3 years of age. Under the leadership of its Prime Minister, India has approved a significant amount of domestic resources to be used for polio eradication.
Could you dedicate yourself to a worthy cause? Could you go the distance to keep a child healthy? Could you travel to the other side of the world to help eliminate polio? Could you? A Rotary member could. We're dedicated to connecting children with vaccinations and ending polio worldwide. All it takes is one person to make a difference, like me, like you. Could you help change the world? Will you? Rotary. Humanity in motion.
The World Health Organization has developed a compelling case for polio eradication. An independent study found that switching to polio control would result in costs that would exceed those of completing eradication by billions of dollars over a 20-year period. In addition, switching to polio control and relying on routine immunization alone would result in over 200,000 children again being paralyzed by polio each year. The message is clear: we must stay the course. Can our efforts in the remaining 4 endemic countries help put an end to polio? Yes. Take a look at this chart comparing the reduction of cases from 2006 to 2007. To reach this goal, Rotary has initiated the Polio Plus Challenge, a commitment to raising $100 million of new funds over a 3-year period beginning December 1st, 2007. Rotary's new Polio Plus fundraising effort will be completed by December 31st, 2010. Each club is being asked to organize a public fundraising event each year for the 3 years of the challenge. Rotaract and Interact clubs are also being asked to get involved and contribute to the challenge. District 6970 is asking clubs to decide their own goals with a suggested minimum of $75 per member per year for 3 years. We want all Rotarians to be a part of polio eradication, especially new clubs and new Rotarians. We want each Rotarian to be able to say, I was part of eradicating polio throughout the world.
This is a tree that was never chopped down to make a crutch that was never needed by a child who never got polio, because medicine was never in short supply, thanks to people whose compassion wasn't either. Over the past 20 years, Rotary Club members have helped immunize over 2 billion children against polio. Thanks to them, the world will soon be polio-free. Rotary, humanity in motion.
Let's all step up to the Polio Plus challenge. Each club in our district needs support from its members. So contact your club president and help Rotary eradicate polio worldwide.